Good Saturday morning to you, and welcome to The Sleep Show. Alongside Dr. Bethaney Brenner, I'm Gary Byron. You can find a lot of information on Dr. Bethaney Brenner, as well as dentistry, as well as sleep issues. Head on over to the website, theburlingtondentist.com. Also, sometime during the show, we're going to head on over to the mailbag. We do have a question that came in. If you've got a question that you'd like to have answered, I want you to write this email address down and send it to drbrennerradio@gmail.com. That's Brenner B as in B. That's funny. I know. It's my sense of humor. As in bzz. I got stung by a bee, actually, a couple days ago. It'd be Dr. Brenner Radio, BRENNER. And that phone number, again, 860-673-7155. I know I mentioned that a little while ago. I can't give it enough. We've got a lot of stuff to go into. Hey, great to see you, Doc.
Yeah.
Yesterday, or I guess maybe the more appropriate last night, Halloween. That's a dentist's dream, isn't it?
Well, it's a lot of fun.
It is.
I think dressing up is great for the kids. I think that, it's a fun night. When I was a child, we always took all the little ones out. The parents rarely were walking the kids, and we all dressed up, even the high school kids. Today.
Oh, they would take the little ones out.
Yeah, they would take all the little ones. And now nobody does that. At least in Connecticut, when we moved here, I was going into high school, and one woman said to me, because we all dressed up to go out, because we were doing that before we moved here. And she said, "Aren't you a little old to be dressing up?"
Okay, so to that point, what age did you stop going out trick-or-treating?
I think that was when we moved to Connecticut. I think I was 13 years old.
Yeah, I was 14.
Yeah. But the high school kids, because we had moved from Rhode Island, they were so clever in how they dressed up. And we had one woman who had homemade everything. So we'd hit her house at least 3 or 4 times, because she'd have the donuts, and she'd have the candied popcorn balls and the candied apples. And
what a different era we're living in now.
Well, of course, now everybody's terrified, right? Because people put dangerous things into foods, which is sick. You're totally sick. So we always got good stuff. I mean, we got candy bars. In those days, they were like a foot long. That's an exaggeration, but they were huge.
Yeah, they were the normal size if you were to go to the store and buy one, not these little things.
Right. So when my kids were young, right, everybody loved to go out for Halloween and dress up. And I had one son who always wanted to be the pirate. And, so I could... It was just fun, right? You want to have a good night. So we take them around. And so I said, eat all the candy as much as you want right now, because they got sick of it and they didn't want any more. I let my kids have candy. Of course I did. It's a fun thing, right? Yeah. It's a fun night, and it's only once a year. I, on the other hand, passed out toothbrushes. And so the kids are like, a toothbrush? I said, well, I'm giving you candy with it. So that's just the reminder to brush your teeth. That's all. I mean, I had to do that. It's, I'm a dentist, for God's sakes. Yeah.
But we all eat sweets.
Absolutely.
I mean, I'm not going to lie to you and tell you.
No, it's how you clean your teeth afterwards.
Well, right. Exactly.
So there are kids that don't. My kids didn't get cavities. So. All
right. So I want to get to that in a second. But even if you weren't eating sweets, even if you're having I don't know, if you're going out for dinner or dinner at home, if you're having dinner, you could get food in your teeth. You should, regardless if it's sweets or not, you need to brush your teeth.
Right.
Okay. It's so funny because over the weekend, last weekend, after we left recording, there was a question. I'm like, I've got to ask her about this. And it has to do with getting cavities. These people who are in their 40s and 50s, and they turn around and tell me, I've never had a cavity. I'm like, what? Here I am, brushing, flossing, doing whatever I can. I probably have had a half a dozen or so root canals.
Oh, really?
Oh, yeah.
Oh,
yeah.
Okay.
So is my mom.
Oh.
Yep.
Okay.
And of course, cavities, but
those are signs of sleep breathing disorders.
Well, we've already determined that, Doc. Come on.
But here's the thing.
I hardly sleep. We know we have a disorder of some sort.
So we also see periodontal disease in those people too. So it's either, I don't want to say we get both, but I have a lot of people that get more of one than the other. So mouth breathing leads to that. Okay. And so when you're not getting the airway opening that you need, you're snoring, you're doing these other things, you will change the microbiome in the mouth, and you lose the good guys who are protecting you, and you promote the bad guys.
So then here's a multi-pronged question, because I want this to apply to sleep disorders, sleep apnea, or even cavities and root canal, dental issues.
Right.
How much of this is hereditary? Because I don't have muck mouth. I brush my teeth,
Yes, you do try. Right, which has probably kept it so that you still have your teeth, because I have people that lose their teeth.
I have all my teeth.
Good.
And I'm always brushing. I guess with the exception of days when, or this is very infrequent, when this is more about me on the couch with the remote in my hand and the game on, and then I wake up and it's already the next morning, and I'm like, oh geez, I'm still dressed in my clothes from the day before, but those days are few and far between. So for the most part, I mean, I'm brushing twice, sometimes more than twice a day, and I have an electric.
I'm sure you're doing a good job.
Well, yeah, and I.
So when you breathe through your mouth,
what am I doing? Why do I have these? Because my mom. I'm sorry, I don't mean to keep interrupting you. How much of this do I go, Mom? Thanks to you, because she thinks it's. I'll kid her, because she's same issues, and she takes good care of her teeth as well. So is it any of this hereditary?
Not hereditary. Maybe the structure of your nose, maybe how your family is genetically constructed, but I would tell you that most of it is environmental, meaning how well you're breathing. So if you have allergies, so when I go back to some of my patients and I say, tell me what you were like when you were 7 and 8 years old. One guy said to me, my nose ran all the time. Okay, we didn't have stuff back in the 70s and the 80s, and even in the 90s that kids sprayed their nose with. Okay, we didn't really do that. We didn't give out allergy medication. So we didn't even, I think it wasn't until the 90s we had allergists actually around.
I'm trying to think.
Right. So you look at, how well did you breathe through your nose? How many colds and flus did you get? There are people who just have their mouth breathers all the time because they never develop the nasal breathing. And it changes how the microbiome of the mouth works. Now, this good news is there are oral chewable probiotics that are used for the mouth. You can reculture the mouth with some better microbiome. And they have them for adults and they have them for children. In fact, I think it was one of the shows when I was first doing this with you back in September, we talked about my brother's grandson, and he was having a constantly running nose. And I said...
Right. I remember that. Yeah.
Okay. So I said to my brother, I have to make a suggestion. I'm not my niece's dentist. I don't live in South Carolina. And I said to him, share this with your daughter and tell her that this is what Oliver should use. And, there's others out there. She can talk with her pediatrician, but the pediatricians often don't even know. So there is some of the ENTs are better, the pediatric ENTs. A lot of them are getting double boarded in sleep and pediatrics. They're few and far between, but they're out there. So this is not new information. This does not maybe commonly or widely known. So you can change some of that.
Okay.
One of the other things that I do for people who really who struggle with the cavities, there's a product called Periogel, which is a hydrogen peroxide gel. Now you'd think, well, I could rinse with hydrogen peroxide, but that's like seconds. You're going to put this in a tray, you're going to put it in your mouth, you're going to wear it for 15 minutes, and we get a total bacterial kill. Okay? So you won't get cavities.
Where do you buy this?
From a dentist. But you got to know about it, and you got to wear
I never heard of it.
Right, you got to wear
What is it called?
Periogel. Periogel. So I have the tubes of it in my office so that the patients that use it. Now, people start off with best intentions, but wearing it for 15 minutes twice a day is a pain in the...
But
Your words, not mine. Anyway.
we didn't break any FCC laws there.
Anyway, the point is that the compliance is a big issue. But I do have a couple of patients that are diehard doing it. I have one woman that's been doing it for 20 years, and she's no cavities, no periodontal disease, and we know she has sleep apnea. She's now a diabetic, and she's had breast cancer as well. She's had a few things happen to her, and no cavities. She's doing great. I know. But, it's a thing, right? So dentists, not every dentist knows, okay? I'm a voracious reader, and I like quirky stuff, so I'll go and say, oh, what's this article about? And I'll start reading that. And I think it's a fascinating world. Dentistry is very interesting.
I'm sitting here every Saturday morning with you, agreeing with you. Yeah, it is fascinating.
It's just information now there are good dentists out there, and they may not have heard of it either. So hopefully they're listening and they can bring that kind of product in.
And I think the key thing here is, and I've said this to you before, I didn't know this was all interconnected.
Oh yeah.
I think I said that to you last week.
Yep.
It's true. Who really treats sleep apnea? I mean, is it a dentist? Is it there's neurologists? There's other doctors that you've been mentioning here.
Yeah. So I know a few. So here's the thing. You can treat it as a dentist if the physician says, these are the options. What does the patient want to do? Because we want compliance, right? So some people just can't wear a CPAP, and they'll tell their sleep physician, I can't do that. I won't do that. Others will try to do that, like my brother did, and he said, I put it in the closet. I can't wear this thing anymore. But you do need a physician to say, look, you can use several different kind of methods to help this patient. If they want the CPAP, we'll facilitate that for them. If they want to do an orthotic, so they wear when they go to bed, you can do that. I also use, they call it epigenetic orthodontic therapy, but basically I use clear aligners and I widen their airways. And we actually teach them, so we make the airway more breathable so that they breathe through their nose. And I get very good results with that. But you also have to change how you're eating, because the food swells up the turbinates of the nose. And the minute I do another sleep test and I see the respiratory distress index go up, because I have a guy, and he's like, we had him fixed. He was down under, he had 2 or 3 episodes max per hour. And then we made him his orthotic, and then he's like, he got a cold, and now he's gone down the tube. So I'm getting him back in the office. We've retested him, and I'm like, I can see his RDI is all messed up. So it's like he's eating something that's not agreeing with him. So you can't go backwards. You have to still practice some of the things that we teach you, like breathing through the nose.
So you would agree, there are different treatments then?
Sure. Everybody has their techniques. And I think I've said this before, and I think I said it on the first broadcast that we did. I'm not a fan of the mandibular advancement devices. Right now, do I think they work? The answer is yes. What other problems does it cause for the patient? So I'm always kind of like, the side effects of what you use need to be taken into consideration. However, we also have some people, they don't care. And so they make a mandibular advancement device. Do they work? Yes, they work. Is it going to create a TMJ problem?
Probably.
That's the issue. And women don't want to end up looking like Jay Leno. Their jaw's sticking way out, right? And sometimes that's what happens. The jaw will get into a different position and stay there. And so, yeah.
Oh.
So, yes, there are different ways of treating it. So we call it epigenetic, sometimes myofunctional therapy if they're very mild. And I get a few of those. Myofunctional therapy can be very beneficial, and I have myofunctional therapists in Connecticut that we can refer people to. These are just different things. So it's, yes, one size does not fit all.
Well, there's obviously different treatments for each person, because to your point of one size does not necessarily fit all, but you've got children who are in a whole different category as adults,
and they have completely different symptoms.
Right, and even adults. If you're just starting this issue. And then there's adults who have had this for most of their lives. I would imagine.
Correct.
The
And they did not know it.
Oh.
Right. So usually when they come in and they have, I'm going to say the classic narrow face, they have asthma, they have allergy issues, they're constantly taking medication, they've got gut issues.
Well, who doesn't have that at middle age?
No, not the protrudings of the stomach. They get GI upset.
Oh.
Okay, so they have bloating, they might have SIBO, they might have Crohn's, they might have celiac. All these things weigh on how their gut functions. Some people are more constipated, some people are the loosey-goosey girls. So it varies. But people suffer more from gut issues than sometimes their sleep apnea.
I would imagine the sooner you are at getting this looked at or treated.
Well, that's why the children are so important. That's when we can actually make a big difference in their life, in their face. If we can fix them by the age of 7, and I didn't do that study, that was done in France. These mothers who are dentists who have gone in these, and they are adamant speakers. They try to get on to every dental convention that they can to spread the word. And the trouble is that we're also not talking to the right people. I said many years ago, we should need to educate the mothers of the children. If you educate the mothers, things will change.
Folks, you are listening to The Sleep Show alongside Dr. Bethaney Brenner. I'm Gary Byron, theburlingtondentist.com. That's what you're going to want to check out. But more importantly, I'd say write this phone number down because I'm going to want you to call it in a few minutes. 860-673-7155. I mean, I suppose if you need to right now, I just don't want you to miss any of the show. Call it today, call it Monday, call it this week. Just make sure you call it. Again, 860-673-7155. And by the way, there's an email address that for this specific show. This is not to set up an appointment with Dr. Bethaney Brenner. That's a whole other email address, a whole other way of doing business. This is for this show that I'll even, this is the really cool part, is that I'll even read your question on the air. I would imagine if you've come up with a question, several other people may have thought of it as well. So send it to Dr. Brenner Radio, BRENNER, Dr. Brenner Radio at gmail.com. As a matter of fact, very shortly, I'm going to read our first one in a few minutes. You were talking about skull and bone and the shape of your face, long face, round face, so on and so forth. What have we learned from skulls from thousands of years ago?
So they did not have sleep apnea.
nor the doctors to help cure it.
They had to eat a more coarse, or I'll just say a more rugged type diet, right? They ate more whole foods. Think about it. We didn't have fast food around the corner, right? They had to go hunt the food. They had to cook the food. They had to prepare the food. They had to pick the food. Right? Some of them were growing the food, but not too many because they were foragers mostly back then. Okay? Mm-hmm. So it took more effort to chew the food. And what we see with these skulls is that they don't have crooked teeth. They developed wider palates. And yes, because of the coarser food, their teeth were more flat because you wear the teeth down over time. Interestingly, when we wear our teeth down, this is what I saw from some of the Australian families that I've treated, they chew a coarser diet and the teeth get flatter, but it also causes a shifting, not that the right word, friction between the teeth. So the spaces between the teeth open up. So you know how teeth, we all think, oh, our wisdom teeth are pushing our teeth forward and that's why we get crooked teeth, right? Not necessarily. However, we are not eating the coarse diet of thousands of years ago. And so this chewing that makes the teeth kind of go up and down and they kind of wear in between the teeth, which creates like a space, right? Keeps the teeth from getting crooked. It's just fascinating. Wow. Fascinating. And so if you think about how we've evolved, right, we're having less and less room in our mouth for wisdom teeth. So one of my sons didn't have 2 of his wisdom teeth. They never developed in his mouth. And I was like, well, there's the evolution right there. Right? Wow. So I have some people that have 1 wisdom tooth. They don't have 4 anymore. So this is
even with an X-ray they're
not developing them. Right. Right. Think about it. We're having smaller faces.
I never even looked at it like that.
Yeah.
All right. All right, let's go to the mailbag here. I've been excited about this. I meant to do this last week. We ran out of time. I made sure we have time to get to it. So we have our first question here for you. Is CPAP necessary to treat most sleep apnea? It's kind of a three-part question, but you want to start with that one first?
Sure. So, traditional. So it depends on how bad the sleep apnea is. Most sleep physicians, if you have moderate, and I'm not talking the low end of moderate because there's a range, more middle to high end, closer to severe sleep apnea, they will recommend a CPAP. And we actually don't use the CPAP anymore. We use what we call an auto PAP. And they're smarter, they're quieter, they're easier to wear.
I heard that about Otto. He's a smart guy.
So the auto, they're very quiet now.
Yeah.
So, when years ago they used to sound like there was a machine that was, helping you breathe. And so it was disturbing people's sleep. They couldn't sleep with the noise, and especially the sleep partners were complaining. So is a CPAP really good? It can be. It's considered the gold standard, right? Do people get better on it? Yes. I have a woman who she has the nasal pillows. She wears a CPAP, but she was really still struggling. And so we added an orthotic to hers, and now we even dropped her results. We made her results even better.
Oh.
So that now she says, I can't go to bed without my appliance. And she puts her nasal pillows in. And she's become a diabetic because she didn't listen. I can bring the horse to water, but I can't make everybody do what they're supposed to do.
Could have been preventable, though.
And then not only that, it's reversible. But you won't hear that from most physicians because once big pharma's got their hooks in you, they've got you for life.
Not you, though.
No, I will never become a diabetic. I am adamant and determined. So,
how much should treatment cost?
Well, that varies. So, medical insurance, if you have a diagnosed sleep apnea, which of course that's why we check that, they, depending on their plan, their deductibles and so forth, medical insurance will pick up. Some will pick up 100%. That's very rare. We can usually tell people 50% of the treatment cost is pretty much covered, but we have a few that get nothing. So, and they're rare, but they have a very bad medical plan. Yeah. So, and these are all dollar driven. So you have to remember the employer buys the plan, right? They're the ones that contract with whatever company who's selling the different plans. So these are all dollar driven. And I see it even tiered because we've got insurance companies here in Connecticut. The upper echelon of the insurance companies, they have great medical insurance with minimal deductibles to no deductibles to much higher and better benefits. Like I had one executive, he got 80% of a crown covered. That's like unheard of. Normally that's a 50% dental coverage thing. And he had 80. So that just gives you an idea on the dental side. Dental insurance does not cover anything on sleep apnea. They don't even want to cover TMJ issues, okay? Because there's no metric for them. They
don't cover crowns neither, right?
No, a lot of insurance companies will cover crowns, but this is called sleep apnea and TMJ. So it's a medical condition, and they don't have enough in the dental plan to pay for any of this.
So your medical insurance rather than your dental insurance will...
Exactly.
Okay.
So we deal with medical insurance. And medical insurance has its ups and downs. So we tell people, once we try to check on benefits, they probably have a 50% coverage. That's a pretty much guarantee. Some get better, some do more. And then we have the occasional that's like, they don't cover anything. Your deductible is $10,000. And it's like, oh my God, you'll never get there. So there's a range. Depends on what treatment you do, whether you're doing a CPAP, you're doing an orthotic, are we doing epigenetic orthodontics? Are we fixing you? So I have a woman who came in and she had so much dentistry in her mouth and she had implants, and there was no way we were going to do any kind of epigenetic orthodontic treatment for her. She's just too much dentistry done. We would potentially put some of that at risk. So I said to her, and she had really bad symptoms, and so I sent her back to the sleep physician and said she needs a CPAP, and so that's what they did for her. Yeah.
Wow. I just could this be? What's the range of price here? Out of pocket. Out of pocket.
So well, that's always varies. So I would say under $5,000 is usually a pretty good number. We have a few people that can get it. I had one guy say, I called my insurance and they're going to cover 100%. I said, 100% of what? That's
what's the number?
That's the fee. That's the behind the curtain that we were never allowed to see. So that I never know. So that's why we have to do individual checks on it, and we don't know until we submit for it. I'm not a physician, so the physicians are in a completely different category. They have to acquiesce to what the insurance is going to cover, so they get paid whatever they get paid, and you don't have much out unless you have a copay. Okay, so it depends on the medical plan. Now there's gap. I'm not an insurance person. So
what about Medicare?
Medicare will cover
Okay.
sleep apnea. And if you have an additional plan, like AARP, will have an existing
supplemental,
supplemental. Thank you, supplemental plan. They will pick up some too. So for them, they might get closer to 80%, 90% coverage.
Oh,
yeah. So it really depends on the plans, right? And it depends on which because Medicare's got different levels.
yeah. Well, of course, there's different
So
plans.
if you're doing a better level, if you're doing a better supplemental, you'll get more coverage.
Folks, you've been listening to The Sleep Show. You can find them online at the Burlington Dentist is where you can find Dr. Bethaney Brenner. TheBurlingtonDentist.com. Wealth of information there, not only just about the topic that we covered this morning, but any other of the week's previous. Great information. I suggest you start there. If you'd like to schedule a consultation with Dr. Brenner, easy to do that. Write this phone number down. Actually, call it right now, 860-673-7155. Again, 860-673-7155. And again, that email address, if you'd like to get your question answered on these very airwaves as soon as next weekend, in fact, simply send it to drbrennerradio@gmail.com. That's BRENNER. For Dr. Bethaney Brenner, I'm Gary Byron. Thank you so much for listening to The Sleep Show. Until next weekend, have a good one, everybody.